And then Hashimoto's can also cause a lot of these symptoms. And in the beginning stages, people will often have mixed symptoms. So they might be feeling kind of lazy and feeling depressed. They might be cold. They might be gaining weight. They might have the brain fog that comes with an underactive thyroid and the hair loss. But then on the other hand, they might also have the irritability. They might have palpitations. They might have anxiety. They may actually have, temperature swings like people who undergo menopause would, where they're feeling hot and then they're feeling cold and then they're feeling hot and cold. So this is something that can definitely occur as a result of that. And also another big thing is if you're overdosed on your thyroid medication, you can have a lot of these symptoms as well. So those are some of the reasons with, making sure that your thyroid is dialed in, because too much of thyroid hormone can be just as bad as too little. And in fact, an overactive thyroid can be worse. I know, unfortunately, people have self-medicated themselves and said, I'm still tired, I'm still losing my hair, I'll just take more of this thyroid medication. And that can actually be dangerous. So I would definitely recommend monitoring your thyroid lab testing if you're on any kind of medications to make sure that you're getting just the right amount of the thyroid hormone.
Is female hair loss a common symptom of Hashimoto's?
Yes, so it's actually one of the most common symptoms of Hashimoto's. The other most common symptoms when I survey my readers and my clients are going to be fatigue, trouble with losing weight and putting on too much weight. Then there are mood disturbances like anxiety or depression. And then the next one that people report is hair loss. And, it can be very distressful because every time you look in the mirror, every time you brush your hair, you start losing hair. For me personally, I was like, I don't want to brush my hair. I don't want to wash my hair because every time I do, I lose so much of it. And this is a very, very common symptom of Hashimoto's and hypothyroidism. Unfortunately, not many endocrinologists will tune into that. So when I was first diagnosed, I was losing hair, and my endocrinologist told me that was not due to my thyroid. Of course, then I went to a hair specialist who said, yes, this is due to your thyroid. So, I would say if you're losing hair, I would suspect the thyroid as, look at your thyroid as suspect number one.